Welcome to Nursing Education of Ehlers-Danlos Syndrome. This series is being offered by EDS Awareness, a group whose foundation is to support sufferers of EDS and its related conditions. Catherine Haig. I'm currently a nurse practitioner in emergency neuro-ophthalmology. I work in the NHS in England, and part of my job is also the clinical education of nurses and allied health professionals. I was personally diagnosed with EDS in my mid-50s after several complicated back surgeries. I also have family members who have it, including a sister and two daughters. I'd like to say thank you to the EDS Awareness founder, John Furman, and the organizer of this series, Beth Fahlberg, for giving me the opportunity to participate in this series of nursing education. Or Ehlers-Danlos syndrome is a group of connective tissue disorders. Most appear to be caused by gene mutation. However, in some families, a cause is not able to be identified. It was originally associated with hyperelasticity of the skin and hypermobility of the joints, hence the origin of its name. The name Ehlers-Danlos has been used since 1936 and was named for the case reports of the Danish dermatologist Edvard Ehlers and the French doctor Henri Ehlers-Danlos, who had a special interest in the chemistry of the skin. That we now associate with EDS have been around for centuries. In fact, hypermobility was even described in reports by Hippocrates. Though most commonly associated with skin hyperelasticity and joint hypermobility, through genetic research and clinical advances, we now know that EDS encompasses an entire spectrum of diagnoses and symptoms. EDS expert Professor Rodney Graham has been quoted in many articles as stating that EDS is one of the most neglected disorders in the history of modern medicine. Defining what EDS is, it's very important to also define what it's not. EDS is not a collagen vascular disease, nor is it an autoimmune disease. It may, though, have similar symptoms to those disorders, such as pain or inflammation and fatigue, all related to the breakdown of connective tissue. That's not to say that a person cannot have either of those disorders and EDS. My sister, for instance, has two autoimmune disorders as well as EDS. She's living proof of what is a medical principle attributed to John Hickam called Hickham's dictum that states that a patient can have as many diagnoses. As I said, by definition, is a genetic connective tissue disorder. It affects a collagen or specific proteins in connective tissue. In order to understand it better, it is necessary to understand first the A&P, or anatomy and physiology of connective tissue. Tissue is the most abundant type of tissue in the body. It provides a supportive structure for essential organs and for our movement, and therefore any defect in connective tissue will inevitably have a huge impact on most bodily functions. All connective tissues have the same embryonic origin. They are mostly non-living material with varying degrees of vascularization. Connective tissue is comprised of both cells and extracellular matrix. Extracellular matrix is made up of ground substance, which is mostly proteins, starches, and water, and fibers, which range from very strong fibers, like collagen fibers, to very delicate fibers, like reticular fibers. You can also find elastic fibers, which you see in skin, and things like the aorta. You have three major types, or we will type them according to their function. So we have fluid, which is seen in the blood and lymphatic systems, fibrous, or what you can call proper, which is seen in the organs and blood vessels, and supporting structures. And then you have supporting connective tissue, which are the more firm supporters. The fluid portion of connective tissue is quite self-explanatory. We'll just continue to fibrous connective tissue or connective tissue proper. There are two categories, loose and dense, and these are each subdivided into three subcategories. Under loose fibrous connective tissue, you have areolar, which is found in organs and blood vessels, adipose tissue, which is further subcategorized into brown and white. White adipose tissue stores energy, while brown adipose tissue generates heat and is most abundant in infants. There's reticular fibrous connective tissue, which is found in the spleen, lymph nodes, and bone marrow. And then in dense fibrous connective tissue, you have regular, irregular, and elastic. Regular being in the tendons and ligaments, irregular in the skin and periosteum, and elastic in the arteries, trachea, and vocal cords. Connective tissue includes both cartilage and bone. Cartilage can be subdivided into three groups: hyaline, fibrocartilage, and elastic cartilage. Most nurses, I believe, will know that hyaline cartilage is found in the respiratory system, synovial joints, and the nose. Fibrocartilage is in the spinal discs and the knee meniscus, and elastic cartilage is in the epiglottis and the ear. EDS is considered to be a rare disorder. It is estimated that it is significantly underdiagnosed, and there's a wide range in the actual predictions of what the prevalence actually is. We know that hypermobile EDS is extremely underdiagnosed and much more common than is represented in the figures. Prevalence goes with EDS. It does seem to have equal prevalence in both men and women. However, symptoms in women may be accelerated and a bit more debilitating after puberty, whereas in men the symptoms may improve after puberty, and this seems to be directly attributed to hormonal influences. As far as ethnicity goes, it does seem to be quite similar across ethnic groups, although there is a question of whether there is a higher prevalence in Caucasian. Forms of EDS are recognizable in early childhood. However, some symptoms do not manifest until later in life. Many are diagnosed in young adulthood, although many people are not diagnosed until well into their middle years. Because of the variety of symptoms, it can often take 10 to 20 years to be diagnosed. This also brings up another medical principle called Occam's razor that suggests that if you have many varied symptoms, assume that there's a single cause, which I think is quite appropriate for EDS. In 2017, there was a reclassification of the diagnostic criteria for the subtypes of EDS. There are now officially 13 recognized subtypes of EDS. This particular slide lists all of them, however, we will briefly go through them. There is a webinar by Dr. Claire Francomano, who's an EDS expert, online and on YouTube that goes into great detail for the. Just to briefly go over some of the subtypes of EDS and some of the symptom manifestations. Number one is classical EDS, which involves extremely hyperextensive skin, atrophic scarring, and joint hypermobility. Number two is classical-like EDS, which is much like number one. However, it includes a more velvety textured skin and bruising, but not scarring. Number three is cardiac valvular EDS, which I believe is extremely rare. It involves severe problems with cardiac valves, often the mitral and the aortic valve, also joint hypermobility, hyperextensive skin, and atrophic scarring. So you can already see a pattern here that many of the symptoms overlap with other types, so diagnosis can be really quite difficult. Number four is a fairly rare type of EDS, and a very serious type of EDS, that's vascular EDS, and that can involve arterial rupture, or organ perforation. Number five, hypermobile EDS is the most common type of EDS by far, and is the most likely EDS presentation that you'll see in primary care or at the GP office. It involves joint hypermobility, generalized connective tissue problems, and musculoskeletal issues. Number six, arthrochalasia is a severe generalized joint hypermobility, often seen at birth with congenital bilateral hip dislocations and hyperextensive skin. Number seven, dermatosparaxis involves skin fragility and has some specific facial bone structure features. Number seven, kyphoscoliotic EDS. It lists here that they have muscle hypotonia and joint hypermobility with dislocations and subluxations. Obviously, that is also seen in hypermobile and other types of EDS, but this involves a congenital kyphoscoliosis as well. Mine is brittle cornea syndrome. This may result from an early onset of keratoconus or keratoglobus. It involves a thinning of the central cornea. These patients may end up having to wear a contact lens to protect their cornea. Some end up with a corneal transplant. You may see a blue sclera as a presentation in an ophthalmic situation. We've seen this at work, actually. Number 10 is a spondylodysplastic EDS, which presents with a short height, bowing of limbs, and muscle hypotonia. And number 11 is musculocontractual EDS, which involves multiple congenital muscle contractions. An example of this would be clubfoot. They also may have skin fragility, bruising, palmar wrinkling, and again with a 12 is myopathic EDS, which presents with both proximal contractures and hypermobile distal joints, and congenital muscle hypotonia. Number 13 is periodontal EDS, which presents with early severe periodontitis, possibly a lack of attached gingiva, and pretibial plaques. To summarize, what you may see in a patient with EDS is a presentation of a chronic systemic and multi-system condition. These patients may have flares of certain problems, such as GI problems. They may have comorbid conditions. They may have associated conditions, such as POTS or postural orthostatic tachycardia syndrome. Some EDS sufferers state that they have something called MCAS, or mast cell activation syndrome. Their course of symptoms may be very variable, and have a very variable impact on their life, so that you may see a very highly functioning EDS sufferer who may be an athlete, where you see them occasionally for something, a GI problem or a hypermobile joint, or they may be severely debilitated, even bedridden. Section 1. We would like you to know that EDS is a genetic connective tissue disorder. There are 13 subtypes, with hypermobile being the most common type. It is a systemic, chronic, and highly underdiagnosed disorder that has a significant impact on a patient's life. Join us in Section 2 for what's happening in the body and how it impacts the person with EDS. Thank you.